Hey everyone, welcome to the Commercial Carrier Corner. I'm your host, Jared Taylor. Joining me today is the CEO and President of the Associated Builders and Contractors Insurance Trust, Adam Bonsky. Adam, how's it going?
Hey, good, Jared. How are you?
I'm doing well. I'm excited to have you here today. We have some cool discussion points we want to go into, and why don't we just dive right into this? So
Oh, great.
we've touched on captives a bit before on this show, but today we're going to dive into something a little bit more specialized. So the Construction Healthcare Alliance, which is managed by ABC Insurance Trust, as we mentioned earlier in your intro. For those unfamiliar, could you explain what it means to be a national homogeneous captive and why that structure is particularly beneficial for your members?
Sure, you bet. So, homogeneous is a lot like it sounds. It's a captive that is designed, constructed, managed year over year, all with one particular industry in mind. So, the only people who can join our captive, the Construction Healthcare Alliance, as you might imagine from the way it sounds, are construction companies who are members of the Associated Builders and Contractors National Construction Association. So we believe that, up front and over time, contractors are going to know what's best for contractors when it comes to healthcare, right? The ABC is a perfect example of that. 24,000 members come together in an association and share best practices and fight for each other statewide and at the federal level for things that are good for their industry. So why would it be any different in a captive? And if you think about the program you build for a captive, the underwriting, the services for the employer, the service model you build for the employees or your workforce, the proactive care you put in place, the governance and the committees that come together to design and approve changes to the captive going forward, if those are all construction companies who are like mind and like challenges, have similar challenges, if you will, that's the best way, in my mind, to really make a captive sing over time.
Now, construction companies, and for those that don't know this, I also host some stuff in the construction space. So I've learned a fair deal about that industry over the last couple months. But construction companies face unique challenges when it comes to providing benefits to their workforce, more so than probably a lot of other industries. Can you share particularly just a couple examples around what these challenges look like, and then how you're working with the Construction Healthcare Alliance to address these issues?
Yeah, you bet. I would actually make a bold statement that is, there's no industry that has more challenges when it comes to employee benefits than the construction industry. My team recently did a brainstorming exercise, and we came up with over 30 separate and distinct significant challenges that construction companies have when it comes to designing, building, managing their employee benefits. So some of those things would be affordability, right? Which then creates serious issues when it comes to participation in those health plans. Participation is oftentimes less than 50%, sometimes less than 30% of the workforce, which then makes it very difficult to find carriers who want to cover that risk. Because it's expensive, it's not just the premium that's expensive. The deductibles are often quite high, and so employees avoid care or put off care. The competition for labor has never been tougher in the history of the construction industry, I would suggest, or at least in recent history. And so they have lots of turnover. They're constantly fighting with trying to attract workers to come work on their projects. Compliance is really challenging, especially if you're working on government projects that are subject to the Davis-Bacon Act or state prevailing wage laws. With the infrastructure bill and the IRA passed under the current administration, there's hundreds of billions of dollars coming out of new projects, and contractors have a hard time complying and building benefits that match up with those regulations. They have seasonality in certain parts of the year where they can't even work because it's winter and they're a road builder. They have cash flow challenges. They have multiple locations and oftentimes lack of a physical workspace. So the employees are getting information through leaflets or on their mobile devices. There's mental health challenges in the construction arena. It's actually, I think, the second highest industry when it comes to suicide rate. And then access to care in rural areas is near impossible. And so finding a doctor in a rural area where you're 100 miles away from home can be a big challenge. So uh, the list goes on. There's so many challenges construction companies have. And so where we can help is we're specialists first and foremost. So we're not your primary care doctor, we're your cardiologist. We're the folks that have worked with construction companies for decades. And so we know kind of the ins and outs of what benefits look like when they're done right in the construction arena. So we've designed that captive, the Construction Healthcare Alliance, with those things that we know about the industry in mind. The trust doesn't have any owners or shareholders. So we use trust assets and trust revenue to bring down the cost of premium and to help pay for benefits administration, because it's not just the premium you're paying for, you're also paying to administer your plans, right? So you've got the Affordable Care Act to contend with and all the tracking and reporting that comes along with that, COBRA, HSAs and FSAs, 5500s you got to file, enrollment portals you got to pay for. So we can use our revenues to help bring the cost of those administrative tools down or even pay for them outright. Within the captive, we use aggressive cost containment, things that contractors probably don't get when they're in a fully insured environment, that can drop their overall annual healthcare costs by 15 up to as much as 40%. A lot of captives have collateral requirements, and those collateral requirements require a big check to be written up front. So we allow contractors to pay that collateral requirement on a per employee per month basis over the course of the first 2 years that they're in the captive. So it spreads out that cash flow for them. So there's all sorts of ways that we can build a program to be more commensurate with or more in line with what a contractor would like based on their particular needs and wants. We have accounting tools that break monthly premium down into an hourly rate. Because we all know all the work that contractors do is hourly. 75% of their workforce is all hourly. So what if you could pay for your premiums or your self-funded healthcare plan costs on a per hour basis? So there's all sorts of ways that you can build health plans or bring the unique knowledge and experience around how to comply with government regulations to a contractor. So hopefully that answers the question. There's all sorts of ways to help these folks.
Absolutely. Yeah. So the Construction Healthcare Alliance is dedicated not to just reducing and controlling healthcare costs up front, but also doing so over the long term, right? So additionally, you're very passionate, clearly, about improving the overall health and healthcare services for this workforce. What is your vision though for achieving this? Like what still needs to, I guess, happen? What's top of mind when you're doing this?
So as you said, first things first, you got to reduce the cost, right? When it's as expensive as it is, employers don't provide care at all or don't provide a healthcare plan, or the deductibles are so high that the employees just avoid care, right? So you've got to first address the cost. And then what we want to see is employers who free up a lot of cost, who save hundreds of thousands on their healthcare costs, take some of those dollars and invest it in what I would call relational care, not transactional care. So for me, healthcare, and I'm sure you would agree, healthcare is human, it's personal, it's emotional, right? And generally speaking, I'm not going to engage with my health plan or get involved with preventative care through an app or through a website, particularly not in the construction space. So we want to see contractors spend their savings on things like direct primary care, or if there's not direct primary care available in your local market, then virtual primary care. We want to work with contractors to set up pop-up clinics on their job site or job sites where employees can engage with their care providers right there on the job site and not have to leave work or lose hours. Direct primary care is so different from traditional primary care in that these doctors don't work within the insurance model. They take a membership fee to belong to their practice every month, and they only have, let's say, 400 to 600 patients on their panel. So they're not seeing 17 people a day. So when you set an appointment with them, you're seeing them for an hour at a time and going over all of your risk factors, not just the one you showed up for that day. So for me, where I think there's a big change to happen is to start getting direct primary care, pop-up clinics, virtual primary care, including mental health care, available on a one-to-one basis, on a relational basis with the worker, who then forms a relationship more like they would with a coach or a client advisor, as opposed to like a customer service type relationship. I think we all kind of sense the difference between what it means to be a client versus a customer, right? And so what we want to do is work with contractors to more and more build in that kind of service. And then over time, we now get ahead of those big cost items, those care items that cause people to go to the hospital or have to spend dollars on really expensive medications that drive up health plan costs. So anyway, hopefully that all
Yeah.
makes sense.
Well, so we've had a couple of these episodes so far of this show, and over the course of these episodes, we've had brokers come on. What I would like to ask you as a last question, parting question, is: can brokers partner with you to present to the Construction Healthcare Alliance to their clients and prospects? And if so, how could this partnership support their business goals?
So the short answer is yes. What I would add is that those broker advisors need to have experience and knowledge in partially self-funded health plans, and ideally have experience in working with a captive. So those are kind of the couple of prerequisites. In addition to that, we're looking for them to be committed to the construction industry, have a solid construction practice, show to us that they have a similar passion that we do about helping construction companies, and that even more so, they're interested in joining efforts with the local Associated Builders and Contractors chapter and getting involved in the chapter and getting to meet the members and not just kind of flying in, doing one case and flying out, if that makes sense. We want to see some level of commitment, the requisite amount of knowledge and experience in working with partially self-funded plans, particularly in a captive. And if they can do those things, then we're happy to partner with them. Now, the second part of that is, why would they want to do that, or how does that help them? So if they're working in the construction space, they, much like us, are really working hard to try to solve those over 30 problems I talked about earlier. And so they can work with a specialist who understands this space inside and out, sort of team up, team sell, and work together to bring better solutions to the construction space. In a self-funded health plan, what's great about it is that there's all sorts of flexibility in how you can build the fixed costs associated with that plan. And so we don't need to get in the middle of the relationship that they have with their client. If they decide with their client what their fee is going to be on a per employee per month basis or on a fee for service basis, and if it's a per employee per month basis, we build it right into the cost of the self-funded plan, and it's included in what the client pays month over month in their fixed costs. So we don't need to be in the middle of that conversation, unless it's a ridiculous fee, of course. But provided it's a reasonable fee and they and their client agree to it, we put it right into the captive and move on, and they perform their services and we perform ours as program manager of the captive.
I love it. Adam, it's been a pleasure. I know what people are saying when they or what they will say when they see this. It's, these two know how to make bald look really good, is what I think the feedback's going to be, plus good conversation. So we will take the compliments, and if no one says it, we'll create an account and we'll say it anyhow. How about that?
I like it. I always tell people my barber just doesn't know when to quit. Right?
There you go. I love it. Adam, it's been a real pleasure having you here today. Thanks for sharing some knowledge with us, and look forward to future conversations.
Thanks for having me on, Jared.